Hi, I'm Dr. Amy Myers. Today I wanted to talk to you about the various forms of magnesium that we offer on my store. So magnesium is what we say is ubiquitous in our body. It's in every cell. We need it to run every cell in our body, our muscles, our hearts, our brains. And the idea is that actually most of us are magnesium depleted or deficient nowadays because of our soil, because we're all drinking caffeinated beverages that pull magnesium out. And so many people are actually running around magnesium deficient, which is perhaps creating some muscle cramps for you, some anxiety for you, some constipation for you, some irritability, inability to sleep. So we have different forms of magnesium to help with all of these different issues. So the first one I want to talk about is magnesium glycinate, and this is the one that I use for just sort of general magnesium deficiency. And again, symptoms of that could be muscle tightness, irritability, muscle cramps, even people who are having things with their heart, such as like AFib or different conduction issues with their heart. So I recommend pretty much everybody could probably use a little bit magnesium in their life, and you can certainly take 2 to 4 of these a day or even more depending on if you're working again with a practitioner or not. The second type of magnesium that we have is magnesium citrate, and this is what I'm usually prescribing to my patients or suggesting to my patients who have constipation. So this is sort of two-stop shopping. So it's helping with their magnesium deficiency, but also helping them through an osmotic gradient with bowel movements. So this is my go-to for those people who come into our practice with constipation or slow-moving bowels, in addition to obviously dietary changes if they haven't already made those. So again, with this supplement, you can really take up to the point that you have a loose bowel movement, and then you would back down to where you didn't have a loose bowel movement. So that may be 2 for you, that may be 4, that may be 6, that may be 8. I probably wouldn't go above 8 to 10 without being under the supervision of a practitioner for that. And best to start this at night and have it work for you through the night, and then wake up, and then as you know how you respond to it, you can see if you can be taking it during the day or if just taking it at night works for you. And then hopefully you'll be working with somebody or changing the diet that your bowel movements become more regular and you can back off of this. And then our newest product, which everybody here in the office is loving, including my husband and me with my husband because he's been a little restless lately, is this new magnesium that we have that is a combination of a whole host of different types of magnesium that have actually been formulated to help it cross the blood-brain barrier. And what that does, it makes for really restful sleep for people. So this has been a big hit and a big winner in our office and for our patients lately, that those people that were having difficulty sleeping, this product is really great. It doesn't give you any kind of hangover in the morning. It's sort of a gentle calm and relaxation. I personally just actually use it during the day to just help. I'm sort of a type A personality go-getter, and it helps just calm me during the day. So it can be used at night or during the day. It's been really helpful for people with restless leg syndrome. So anxiety, restless leg syndrome, irritability, sleep, type A personality, things like that. Again, whenever you're trying a new product, particularly one that could be calming, you always want to start that one at night. And this one comes with a little scooper that you just put in water. I will admit, it is quite sweet if you're not used to, having sweet things in your diet, like I'm not. It tastes like a grape sweet tart. So, but it is actually good, in terms of having something sweet, but it was a little bit of a shocker the first time I tried it, so just forewarning you there. But nice, great flavor, and it is really helpful with just calming and sleep. So overall, in general, I think most people are magnesium deficient, and then really depending on what your potential issue is as to what type of magnesium you'd need. So the magnesium glycinate is for just general magnesium deficiency, maybe some muscle aches, anxiety, calming, muscle aches, things like that. The magnesium citrate we typically are using if you have constipation. And then again, you'll want to dose up till you start having regular bowel movements or even a loose one and then back down. And then we have our Neuromadcom, which is crossing the blood-brain barrier and really creating a much larger calming effect for people, helping with restless leg syndrome, helping with sleep issues, and definitely helping with sort of anxiety, ADD, sort of scattered brain or type A personality issues. All right, so every cell in your body has magnesium. Most of us are deficient, so see if one of these fits your needs. Take care.